The numbers are troubling but not surprising for the many black health leaders who've been calling on the collection of race-based data since before this deadly pandemic. Now, the city's data shows that black people and people of color represent 83% of reported cases. Now, attention turns to why and what's next.
You're secretly hoping that that is not the case, but every indication told us that that was what we were going to see.
The glaringly different experiences of Torontonians during COVID-19 paint an ugly picture. 21% of cases are in the black community, despite the group only making up 9% of the city's population. South Asians or Indo-Caribbeans account for 20% of cases, though only 13% of the population. Only 3% of the population are Latin Americans, but they represent 10% of cases. Now, compare that to white people. That group makes up nearly half of the population and only 17% of cases. These are the signs of an unequal pandemic that experts warned about.
We are not surprised, but what we've been asking for a long time is our plans, strategies from our different levels of government to address these issues.
Any pandemic will show you the fissures that exist in any society, and a pandemic only cracks them open further.
Toronto's racialized groups, 52% of the population, also make up 71% of COVID-19 hospitalizations. The root of it all, systemic racism.
If I was to eliminate anti-Black racism, you would see the number drop. I can go down the list of all of the social determinants of health, and you can see why racialized populations, because of how we're positioned in Canadian society, are more at risk.
Calls to address systemic racism aren't new. You've heard communities calling for a plan for decades now. And in the case of COVID-19, much of it boils down to basic socioeconomic factors. And data shows the less money you make, the higher the infection rates. And your employment plays a major role. Can you stay home to work? If not, do you have proper access to PPE? How many jobs do you have? Do you get sick days? These factors put certain communities at greater risk.
We also see an overrepresentation of racialized women in particular in healthcare and frontline healthcare, in the nursing homes, who are the personal support workers.
In communities like those in Northwest Toronto, we do have people living in some of them living in substandard conditions in crowded spaces.
And not addressing the social determinants of health means there's no understanding of these factors. In the case of certain communities, they are more prone to certain stress-related illnesses that put them at further risk during a pandemic.
We do know that the prevalence of things like diabetes and other chronic conditions affect the Black population, the South Asian population. Again, some of it may be genetic, but others are social factors, social determinants of health. And those are the folks who are especially susceptible and burdened by the COVID virus.
There is a larger need to look at systemic racism, specifically in healthcare. Prior to the pandemic, there were already calls to collect race-based data to identify other health inequities and determine who is most vulnerable and how to address it fast.
Interesting that they were able to do it in such a rapid manner and such a well-developed manner, which also tells you that the ability has always been there. It's about political will.
And the province is requiring all public health units, not just Toronto, to collect this data, saying it will eventually make it public. We just don't know when they'll be doing that. Now, community health centers like the one in Black Creek have long been warning about these health inequities. In fact, they've been tailoring their own personal services in order to respond to the needs of the community. To learn more about that and get a link to the data, you can head to our website, citynews.ca.